So many times when people are thinking about ageless, they're thinking about the spa services, and they're not really thinking about the wellness services. However, when you're thinking about the spa services, and when you're thinking about your skin, the skin's the second largest organ.
Right? Exactly. And to go back to when we were talking in the very beginning about making a decision to where to focus with wellness, what's the biggest problem America is faced with, it's obesity. One of the thoughts about that is, well, why is that? Well, in many people, the biggest organ in their body is the adipose tissue, the fat tissue, highly inflammatory, highly problematic, and it significantly affects the second largest organ, which is, or the first largest organ, which is the endothelium, the lining of the blood vessels. So if we're going to take care of the fat tissue, we're going to, by definition, with reducing inflammation, we're going to take care of the endothelium. The second largest organ, your skin. So we have to take care of the skin very well. And that's one of the areas that our medical estheticians focus on. And many times you can tell when you look at someone's skin that, okay, there's a problem here. It doesn't look healthy. Is it because of medications they take? Is it because of the diet they eat or the diet that they don't eat? Is it because of alcohol? Is it because of tobacco? And we can focus and then guide them in the right direction. It's not all just about skin products and what to put on your skin. It's about sometimes what to put in your skin. And then, a segue off that, talking about skin, is the treatment that we can do with acupuncture and with cupping. And for a lot of medical issues, and in particular injury issues, sports injuries, we found that the more Eastern approach with acupuncture, acupressure, massage, cupping, that those can be very, very beneficial without necessitating somebody having to use drugs on a daily basis to reduce inflammation. In a situation like that, we focus on adding things to the person's diet, anti-inflammatory foods. There are many websites that talk about a specific anti-inflammatory diet, and they all say the same thing and the things that we know. Don't eat too much fatty, greasy food, focus on green vegetables, and with regards to supplements, there's a million out there, but ginger and turmeric, two very natural roots that can be added to your diet or made into a tea, or you can find them in tablets to help with inflammation.
You know, I've read before that the skin can be a little bit of a reflection of what's going on inside the body. So if you're eating highly inflammatory foods, it's going to be reflected in your skin. If you're eating anti-inflammatory foods, then you're not going to see as much inflammation. Would you find that to be true, or?
That's very true, and you can look at that all the way from problems like acne, where if you get rid of inflammatory foods, you sometimes do quite a bit better, to rashes, which many times respond to elimination of grains in the diet. Psoriasis improves significantly in many patients when they eliminate grains, sometimes eliminating dairy. So it can be a huge change. And folks get lulled into the security that, well, I've got a rash, I can use a cream on it, or I've got a problem, I can take a pill for it. The dietary approach is sometimes a little more difficult, a little more challenging, but once it's been mastered, it becomes a part of life, it becomes a way of life.
I think I'm doing pretty good with the anti-inflammatory foods, but I can't wait to check out the Man Facial. Maybe we'll show you guys a picture of that too when that happens. The other thing that I did want to circle back to, because you were talking about sports injuries, and we see our share of elbows and shoulders, and I just want to tell the Journey members, if along your journey something happens, it's so much better than what will happen if you don't take the journey at all, right? So, we might deal with some elbow inflammation, might deal with some shoulder inflammation, but it's so much better than really dying early and all the different issues that come from not exercising. But, I've had an elbow issue before. Can we talk a little bit about how cupping or acupuncture actually just goes in and kind of helps that elbow issue or whatever it might be?
Sure. The body has one way to respond to anything you throw at it, and that's inflammation. So it can either build and get stronger, or if there's an injury, it responds with inflammation, right? Redness, swelling, pain, and heat. And everything that acupuncture and cupping does is designed to reduce that inflammation. Whether you do acupuncture with electroacupuncture, with the application of heat called moxa, or whether you do cupping, which is, you can think of cupping as the reverse of massage. Massage is pressing down, cupping is pulling up to allow better flow of liquids through the tissue, through the fascia layers. Everything is designed to get rid of inflammation, either to make the inflammatory substances move away or to make the whole process stop. And if you're doing that from a multi-pronged approach with your diet, with modification of the exercises, which I think is a phenomenal thing that you do in your program, is that every trainer with every exercise talks to everybody in the room. Here's the modification. If you're not into, and even if you're not into getting on the floor today, here's the modification.
Yeah.
But with the diet, the modifications of what you're doing physically, and that can be a journey, or that can be in your office, modifying your desk situation. And then with the application of the correct dietary supplements, again, very simple. And then finally with the treatments that we can provide, whether that's hands-on with massage, or whether that's acupuncture, cupping, or if it comes down to it, medications. I think that that's the multi-pronged approach. And one of the things that I often tell people is, they'll say, I just don't feel good, and I don't feel strong, and my balance is bad. And we immediately go to, what are you doing about that? How are you fixing that? Because I can't fix that with my prescription pen.
Right.
How can you fix that? And when those people start to exercise, it's just amazing to watch the transformation. You know, the change in balance when their core strength improves, the change in their mental outlook and the way they sleep and the way they eat and the way they, everything, as they begin to get stronger and more comfortable in their own skin.
Yeah, if it doesn't challenge you, it doesn't change you. If you're struggling with some balance exercises at Journey, get excited, because it's changing your balance, it's improving it. And that's why we even have secret exercises to stimulate your core while you're balancing, so then that way the core turns on. Really good. You mentioned the word electroacupuncture, and I was like, you know, when I think of acupuncture, I think of needles and different things like that. It sounds like there's different kinds of acupuncture to be aware of or whatnot.
Yeah, electroacupuncture comes in kind of two different flavors. One is where you directly stimulate one of the meridian points with an electrical stimulation device. And some of them are even designed so that when you get to the correct point, it will provide you with a tone, knowing that that's the place that you stimulate.
Oh, that's great.
And if somebody is going to need acupuncture regularly, we can teach them how to do that and get them the device themselves. The other is that you put needles between 2 points, and with a small 9-volt operated device, you run an electrical current there. It's a little different than TENS. TENS units is transcutaneous, where the patch is on the skin and it transmits it along the skin. These needles are deep down into the tissue. Sounds like it would hurt, but it doesn't. And it's stimulating along a specific meridian. So it works, but it works in a little different way. Would I say it works better? In some cases, for sure, but you know, the TENS units now are available over the counter.
Yeah.
So you tweak your back, you can buy a TENS unit, and it works on Shaquille, it should work on us.
That's right, that's right. You know, I love the fact that now technology is letting you know when you're at the right meridian points, you know. It's
Exactly.
so amazing. So amazing. So amazing the technology that's available here. You know, I had no idea. I'm glad I came over, because I think I'm signing up for a few different services. I definitely want to check out this machine, find out what's going on with my metabolism. Hope you do too. There's so many different things. If you're suffering with pain, if you're dealing with joint issues, there's a lot of different ways to address it. Maybe you're addressing it right now with chiropractic or PT, but I loved what we were talking about. The most natural, most effective, and also least expensive. Have you checked out that avenue? So I want to thank you for your time today.
Thank you, Travis.
Thank you so much. Guys, I encourage you to get over to Ageless. We're struggling with lots of different things. It's not a one-size-fits-all. If you're curious about what your metabolism is, if you're struggling with joint issues, if you want to work on your skin, which is the second largest organ, I learned that today, so many different things, so many different solutions available to you. Make sure that you explore them all, because it's not a one-size-fits-all. And thank you for what you're doing. Thank you so much.
Thank you.